Hello and welcome. I am Colonel Patrick Pohle, the commander of the 21st Medical Group, and I'm here with my group superintendent, Chief Master Sgt. Dan Stellabotte. Thank you for joining us today. What we would like to do is have our second installment of what we hope will continue to be an ongoing series of virtual town halls where we can answer the questions that you may have for us as needed and also offer some latest information regarding the 21st Medical Group. So thanks for being with us. All right, so let's get started with our first question. Good morning. I am a contractor here on Peterson and was wondering how myself and my staff would be able to volunteer for the COVID vaccine program. Well, thanks for that question, and it's a good one. We get a lot of questions about how people can sign up and receive their COVID vaccine. What I can tell you at this point in time is we are still working down the DoD schema for who is prioritized to receive the COVID vaccine. At this time, we're in our 1B phase, and we're at the top tier of that. So we focus on units and personnel who are part of the Critical National Capabilities mission here on Peterson and Schriever. What we do, therefore, is we reach out to particular units who fit that requirement, and we have certain POCs within those units. When we reach out to those units, they simply get a list of volunteers from within their unit that they can send to us on a given day and time to receive the vaccine. So if you're a contractor and you work side by side with a unit designated as a critical national capability, just stay tuned for somebody from your unit to reach out to you to say, hey, we have slots available on this date and time. Are you available and do you want to volunteer? If that's the case, you simply join your cohorts as they come over to receive the vaccine from us. If you don't fall into one of those 1B units and you're not considered one of those 1B personnel, I'm afraid it's going to take a while before we get down the list. In the meantime, there are other possibilities for receiving the vaccine. There are community options available that you might be able to access sooner than we might be able to get to you. But again, if you're part of one of the units that we're going to hit as an overall initiative to vaccinate our population, then stand by. One of your unit POCs will be in contact with you. So Chief, this next question I'm going to throw your way. What is the protocol for GS personnel who contract COVID-19 while traveling to an OCONUS TDY location? So overseas travel. Chief, over to you.
Yes, sir. So again, thanks to the audience members who submitted that question. Excellent question, and we need to be prepared as we may do some more traveling as some of the restrictions are eased over this next period of months. And so first and foremost, I would definitely familiarize yourself with the CDC guidelines because the local medical treatment facility is going to follow those CDC guidelines, but you also have to be careful and understand what the host nation and what their guidelines are and their restrictions on policies and also the reentry process if you were to become COVID positive. And so some requirements might mean you have to have a positive or actually a negative test upon reentry into the United States. So really part of that is a planning process, and you also may have to quarantine along with that. So it's being familiarized with the policies in place, what country you're going to go to, and then what the circumstances may deem necessary for your reentry. Thank you for the question.
Okay, thank you, Chief. Okay, and now moving on to the third question. Is testing available for retired military? Great question, but I need to give an it depends type of answer. There are a few circumstances in which we will provide COVID testing for retired military. For example, if you are impaneled to our military treatment facility and you are symptomatic and you contact us or come to see our primary care providers with symptoms that could potentially be COVID, then you are going to be referred to our testing site to receive a COVID test. In that case, we're talking about symptomatic testing for a potential patient situation. In that case, absolutely, we would do COVID testing. Another case where we might do COVID testing for a retired military member would be if it's connected to a civilian job for official travel. For example, if you work on base with one of our organizations and you have to go TDY, then you may very well be tested through our process to make sure you are cleared to go on that official travel and to make sure that you're available for that. If we have a retired military member who simply wants testing for, say, leisure travel, or because they're trying to go to a location that requires it for whatever reason, we consider that asymptomatic testing, and that's something we just simply don't have the bandwidth or capability to do at this time. In those cases, what we would do is we would refer you off base to one of the local testing facilities that are available here on the Front Range. So that's what I mean by it kind of depends. If you're a patient of ours, absolutely, we would get you COVID tested here. If you work on the installation and you're going on official travel for that purpose, absolutely, we would get you tested as part of that process. There are also some nuances related to being a primary contact, but again, it depends on your relationship with our MTF and the installation. What we really don't tackle is asymptomatic testing for the reasons that I mentioned before. Leisure travel, you're trying to go to a certain location, for example, that requires a test. That we simply don't do, and we would have to refer you elsewhere. Okay, so now what we would like to do is just give some more general updates, everything from COVID vaccines, other aspects of pandemic response, how our unit has had to adapt to these other challenges, if you will. So to start out with, for the vaccine initiative here on Peterson and Schriever, we are still receiving the Moderna vaccine. That's the type that we're receiving. And we are exhausting our supplies as they come in. So if they come in weekly, within the next week, those supplies are exhausted, waiting for the next round. What the Air Force is trying to do is get us a more stable, more frequent, more visible supply so that we can do a little bit better job of planning. But that's where we're still at. I mentioned previously that we're still in 1B. That is our DoD schema phase. Again, critical national capabilities is our focus right now. We're hoping to push through those as quickly as we can to make sure that we can move into other categories and other aspects of our population. However, we have learned that there are other ways and other categories that might be able to get their vaccines a little bit sooner. So with that, let me hand it off to Chief Stellabotte for a bit of an update.
Yes, sir. Thank you. So really, and some folks may have seen in the news recently that now at Fort Carson, under their 1 Charlie portion of the schema, so they've moved through some of their population a little bit differently than ours, based on their supplies and their beneficiaries. But you are able to, if you're a high-risk beneficiary, ages 18 to 64, to sign up here soon and receive that vaccination. And so let me clarify, make sure the beneficiaries are tracking what that means. If within the last 12 months you received a pink letter in the mail identifying you as high risk, that means you are one of these patients they're willing to fit into this 1 Charlie phase of the DoD schema. Those patients are pre-identified. They'll receive an automated message from the appointing services line, and then they'll need to schedule their vaccine. The way that you can schedule that vaccine is through our automated appointing services, 526-CARE, so 526-2273. You'll schedule that vaccination, and then you'll be able to go at your identified time and receive that there at Fort Carson. If you are impaneled to the 21st Medical Group, a consult will automatically be placed for you, and you'll receive an automated phone call, and that will also identify you to make the consult on your behalf. So that will be another avenue for you to receive this vaccination shot.
So Chief, based on the fact that there potentially are impaneled patients, but heading to Fort Carson, how is that relationship working and how are we able to do that?
Yes, sir. So really we built a partnership with Fort Carson so we can ensure that we're able to take care of our high-risk beneficiaries and get that vaccination to them as soon as possible.
Okay, so there's another piece of news about vaccines that I want to offer to you, and this is actually pretty exciting. We just recently found out that Johnson & Johnson has now been approved under an emergency use authorization to be able to provide their vaccine as well. Their vaccine is a 1-dose vaccine that's shown to have high efficacy. So we're really excited to see this hit the streets. We have already started getting some questions as to whether folks will be able to get the Johnson & Johnson vaccine through us. What I can tell you at this time is that the DoD will be getting Johnson & Johnson vaccines. However, CONUS bases like ours will not be on the priority list. Those single-dose vaccines will be heading off to more austere locations and combatant commands around the world. So think in terms of overseas installations and locations. Those are the folks who will be getting the Johnson & Johnson. Now, the good news is any additional vaccine that is out there is going to be helpful, because if these other locations are able to take the Johnson & Johnson vaccine, the theory is some of those other vaccines, like the Moderna that we receive, would be more readily available for our stateside bases as well. So we are hoping that with Johnson & Johnson receiving their authorization, that actually increases the odds of us getting more vaccine here at Peterson-Schriever.
So, sir, are there, with all the 3 different vaccines out there now, are there any differences that the public should be aware of?
Well, it's a great question, Chief, because we get a lot of questions, as you know, about should I get this vaccine versus another vaccine? And because it's a one-dose vaccine, people are really excited about the Johnson & Johnson vaccine. In fact, we have found out that our local community is getting some shipments of Johnson & Johnson. And people are wondering, well, should I hold out for that? A couple of points to make with regard to that. First of all 3 vaccines that are available right now have been shown to be both safe and effective. That's part number 1. Part number 2, for those Johnson & Johnson vaccines that can be obtained downtown, remember the state and the county are following their own specific guidelines and schema. And most folks who might be interested in that vaccine would have to meet certain criteria to be able to receive that vaccine on the outside. So the best guidance that we can give right now is get the vaccine that is most available to you at the time. Again, they've all been shown to be safe and effective, so if you have an opportunity to get the vaccine, no matter which vaccine it is, we would recommend that you go ahead and do so. So we spent the last several minutes talking about vaccines because that is the latest news regarding the pandemic and our way to get past the pandemic. One of the things that we wanted to make sure that we did with you today is talk about how some of these aspects of the pandemic and our response to it are impacting the medical group and thereby impacting the services that we can deliver to you. For one thing, we've had to contract our services to make sure that there's more of a focus on readiness care, active duty care, and wellness. The fallout from that, however, is that our dependents and retiree population will need to be deferred off base for acute care needs. Some of you might have already been experiencing this, where you've called in for an appointment and you have been deferred to a local urgent care facility for your acute need. In addition to deferring some of our care off base, what you might also experience are longer wait times for appointments, and the appointments themselves might be a bit longer. Now, most of these curtailment of services impact the Peterson campus specifically. In terms of our Schriever Clinic, what you will most likely find is not necessarily a reduction in the scope of services, but you'll find, again, longer times to wait for an appointment and potentially longer appointment times themselves. We wanted to offer that up to you so you had the appropriate expectation as you reach out to us for your basic medical needs. These constraints on medical care go beyond what we consider just, for example, primary care. It also impacts services that I know many of you take advantage of from week to week, specifically ancillary services such as laboratory, radiology, and immunizations. Chief, would you give a little bit of background about how we've had to adjust lab services?
Absolutely, sir. So the laboratory specifically, their hours of operation now are from 07:30 to 12 o'clock. After that, they have to shut their doors, and here's why. They have to then process the samples that they're taking from the point of testing and get those ready and packaged up so they can ship them out the same day to the Epi Lab and have those results come back as quickly as possible. Also, currently, the lab is not accepting any off-base referrals. Some of our other ancillary services impacts are radiology, but actually that one is pretty robust as is. Their hours of operation are 07:30 to 16:30, and they do have the ability to accept those off-base referrals and take care of those beneficiary needs. Our pharmacy hours remain the same as well, 07:30 to 16:30, out there only at the satellite pharmacy, as the customers have seen over the last 10 plus months. Immunizations, we've had to adjust a little bit as well. Their hours of operations are from 07:30 to 11 o'clock. and they have a break within there, and then they get back online from 1300 to 1600. They're also not able to accept off-base referrals at this time as well.
All right, and one last thing that we wanted to pass along to you is something that we have on the horizon that we think is going to impact how we deliver our patient care. Specifically, it's something we call MHS Genesis. And what Genesis is our new electronic health record. Based on the capabilities that I've seen of this new electronic health record, it's going to significantly improve our efficiency and effectiveness as we serve you, our population. One aspect of this that I think you'll really like is the portal that allows improved communication between you and your provider team. But getting from here to there is going to require a few steps. I currently have my staff going through online trainings and in-person trainings to learn how to use this. And since this electronic record will impact every touch point in this medical group, from the time that you establish an appointment, to check in, to actually see a provider, to then follow-up care and communication, all of those touch points have to get this training. And once they get this training, we will turn this loose at our Go Live event on 24 April. And at that time, what you can expect are some of the same types, or at least similar delays to what we already talked about with regard to pandemic response. For example, you may certainly see longer wait times for appointments. You might actually see fewer appointments on the books, and each individual appointment might be longer as each of these touch points continues to learn and adapt to this new system. Again, we wanted to offer that to you just for your awareness as we approach the end of April, so you'll have an understanding when you face some of these challenges getting access to our clinic. MHS Genesis is one of those programs and challenges that we face in the relatively near future. Okay, so those are the questions and the topics that we had that we wanted to present to you today. With that, we'll go toward closure. Chief, any final thoughts?
Yes, sir. I really like to thank the beneficiary population for your questions and for going through this journey together with us, right? So there's been multiple challenges through this pandemic, the MilCon, which is a construction project, and other things that are going on. But we look to you as your voice to continue to keep us on track as far as serving you and making sure we're meeting your needs. So again, thank you, and we'll look forward to seeing you in our medical treatment facility.
Thank you, Chief. And you have my sincere thanks as well. We appreciate you spending some time with us. We sincerely hope that the information that we're providing is valuable to you as a partner of ours going forward to make sure that we're taking care of your medical needs. With that, thank you so much for joining us.